Hey guys, my name is Austin.
And my name is Ray.
And we're both medical students from Western University of Health Sciences, rotating with Dr. Benzur. And today we're going to talk to you about an important aspect of medicine that unfortunately we don't get exposed to as much as we should during our first 2 years of medical school. And that specifically is the legal aspects of medicine. And as I mentioned, we don't get exposed to it as much as we should. And this is something Dr. Benzur does try to stress during your time rotating with him. And that's why we're making this video for you today. So one important aspect of it specifically is documentation, specifically the patient chart. You should treat it as a legal document because that's exactly what it is. It is a legal document to not only help you manage and keep track of patient records and how they progress under your care for other doctors so they know the same things, but also for the court of law in case something unfortunate happens, such as a lawsuit. And this experience can be either a very smooth one for you, or unfortunately sometimes it can be a rocky road depending on how well you manage your notes. And so that's what we're going to talk to you about today. And one of the first things we like to discuss is the semantics and how you word your notes. That's a very important thing because we've heard, for example, one of the surgeons that you will meet during your time rotating with Dr. Benzur, specifically Dr. Tamari, he mentioned to us about a story when he was a resident, surgical resident, of how wording actually did end up hurting them. This specifically, there was a case where they had a patient that had a gunshot wound. They had a hole on the right anterior aspect of their abdomen, and then another hole on the posterior on the left side. And so in the note a student was working on, they wrote that the patient presented with an entrance wound on the anterior right and an exit wound on the posterior left. And later down the line, this case was brought to court for reasons that we are not sure. But they reviewed that and they actually questioned Dr. Tamari about this because for all Dr. Tamari knew, there were two holes. He was not sure which one was an entrance and which one was an exit wound. And the court really went all the way with this to question why did they say this, their credibility, and this can bring up a lot of things that you would never expect at the time of just writing, entrance here, exit there, because you just assume that they got a shot, from the anterior side. So this goes along with the idea of the semantics. It really is, you have to make sure that you write things that you physically see or for a fact because you were either told by the physician, by the patient, or by maybe someone with the patient that day. The fact that any assumption that you make could hurt you and most likely would hurt you, like in this case. And it's just very important that you stick to that. And that's one very easy thing that you could miss. As a medical student, I know even here on one of our first rotations, you make some assumptions just because you see it all the time and you're writing a note and you want to look complete. But I was very quickly told by one of the other people working here that you can't do that. That's just, although it's a little thing and it could most likely 99% right, if you're not 100% sure, it's best just to not put it at all or just put exactly what you saw. And Ray actually has another story that illustrates this idea.
Mm-hmm. So another story that actually was Dr. Tamari who told us involved using the terms motor vehicle accident, or MVA. And for those of you that have worked in the medical field and healthcare field, you'll probably have heard or used those terms before. It's a very commonly used term in the medical field. The thing is that Dr. Tamari had mentioned that if we use the term MVA for a car accident, again, this is just an example, that it is a motor vehicle accident. If we are subpoenaed or taken to court for whatever reason, and on the documentation it says accident, that implies that there is that one person or whoever was involved may or may not have been at fault. And this could direct the final decision of the court because of this one word accident. And the lawyers can hound on that word and ask tons and tons of questions just on one single word that is very commonly used in medical literature. So as an example, what you would do in that case, instead of calling it a motor vehicle accident, you can call it a motor vehicle collision, because you know two vehicles in this case had collided. That's as much as you know, and that's all you can say. You can't make an assumption or judgment that it's an accident. And this goes along with what Austin was saying before about semantics and wording. It's very, very important. Now for you guys who are watching this video, you're most likely watching this as rotating students, no matter whether you're medical students or PAs or whatever the case may be. If you are writing notes, be sure you're very aware of what you're writing down. Because one simple word change or one simple assumption, as Austin had mentioned, can change the entire view of what the note is trying to be, and especially in a court of law. So just be very cognizant of what you write down. So that's the main documentation point. Put down the things that you know are true, things that the patient tells you. Be sure you guys write down the patient states or the patient notes, the patient said, blah, 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 blah. And don't just say that, oh, instead of that, let's say the patient says he has a headache, instead of writing down patient has a headache, say the patient states he has a headache. Things like that. These are ways to protect yourself. And again, these are things that not only here for Dr. Ben-Zur, but it's a lifelong learning kind of situation where in the future, we want to not only help our patients, but also protect ourselves from any type of litigious situations. So things like the patient reports, or the situation has been reported to be seen by blah, 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 or reported to be done by this. Using those terms and terminologies like that not only gets the message across, but also protects us as future healthcare professionals. So that's the documentation part. The other part the other aspect of the legal medicine, as we'd like to think of it, is the patient encounter in itself. When we go in and see our patients, when you come in, be very humble, be very welcoming, and be very kind and compassionate, that in itself can have a huge impact on how the patient sees us as future healthcare professionals and the whole practice. By being very kind and being very compassionate, very welcoming, we could, in a sense, even possibly lower insurance rates by like 89%, something like that. It's very powerful how the first initial meeting and how you interact with your patients, how powerful that is and how influential that is in terms of how litigious they may or may not be in the future. So the more able you are to make the patient feel welcome, make the patient feel at home, make the patient feel safe and cared for, the less likely that you or we or anyone would be sued in that case. And again, as we have mentioned before, it's a lifelong experience, and although you may be rotating with Dr. Ben-Zur now, no matter what healthcare professional student you are, this is something that's very important for all of us in the future. So make sure documentation is very, very, very important. And there are examples out there online that you can look up that can give you phrases and sentences that you can use when you're documenting. That, again, like I mentioned before, gives the care that the patient needs and also gives us the protection that we need. And with that, that's basically all we have to do. Be very proactive in how you document, be humble and kind when you present your patients, and best of luck.